So we're going to be talking about the eye findings in the post-concussive syndrome. So it's as the name implies, it's post because it's after and after you have a concussion. So after a traumatic brain injury, with or without loss of consciousness, patients might have eye symptoms and signs. The most common are headache, and that means they can have eye pain, photosensitivity, even without having iritis or any structural abnormality in their eye, and they might have intermittent diplopia from convergence insufficiency exotropia. So these three things are the most common things that we see in patients after the post-concussive syndrome. Of course, depending on the severity of the trauma, they might have traumatic optic neuropathy or traumatic iritis or traumatic retinal detachment or traumatic cranial neuropathy like a sixth nerve palsy or a third or a fourth. That's not what we're talking about here when we talk about eye symptoms in post-concussive syndrome. What we're talking about is the concussion itself, not the direct traumatic injury structural elements, is what produces the symptoms of headache, photosensitivity, and the convergence insufficiency exotropia. A lot of these patients have very non-specific complaints, like they just say it's blurry or their eyes are dry or they have eye pain. The important thing is making sure there's no structural abnormality that can be attributed to trauma or some other cause, but recognizing that you need to check distance and near to measure the convergence insufficiency, because that exotropia is only going to be at near, and then looking at their eye to make sure there's no uveitis or some structural cause for their photosensitivity, and then approaching this patient with information. Knowledge is power, but also presenting the information in an empathetic way so that you can help them understand that it's not their eye at all, it's their brain, and that is post-concussive.